Hello everyone, my name is Shirley. I am the digital trainer and scanner specialist at RACE. I was a DA with clinical experience for 7 years and have been with RACE for over 3 years training dentists on intraoral scanners. Today I will be guiding you on an intraoral scan path with tips and tricks on how to get the perfect scan for your RACE aligners. I'll be first showing you the technique on a study model and adapting that technique on a live patient. The baseline of a scan path is shown in this slide. Lowers, occlusion, lingual, buccal, and then in your uppers, occlusion, buccal, palatal. Full disclosure that it is not essential to follow this path exactly, and every clinician will learn what works for them personally. From scanning hundreds of cases, I have found a technique that works for the majority of my full arch cases. Starting from the back molars of your initial occlusion scan, I like to rock from side to side to also capture the buccal and lingual palatal surface of each tooth. This will reduce any stitching errors that can occur on the edge of the teeth when not enough data is captured on either side of the anatomy. Following the scan path of the lower, you go around to scan the lingual, then buccal. You will notice when I come around to the buccal anteriors that I switch positions, restart on the occlusion surface on the other quadrant, and come around the buccal to meet where I stopped earlier in the midline of the anteriors. For the upper arch, rocking again across the occlusion. I like to do the palate first, then the buccal, and reposition my scanner once I reach the anteriors to start on the occlusion of the other quadrant, rolling to the buccal to meet back at the midline of the buccal anterior teeth. Positioning can get awkward around the whole arch, and the beauty of scanning is that you can stop, reposition, and rescan, filling in the remaining surfaces. You can also check your scans in a mono version, as this will show discrepancies in your scans more clearly. For the bite, always start far back on your last molars and move the scanner up and down to capture the buccal surface of the top and lower arch together in the bite. Remember to scan past the gum line and capture the full buccal anatomy of the patient's teeth. Both sides of the bite are required for full arch scans, scanning at least 8 teeth, top and bottom together. Now adapting that same technique on our live patient, Brendan. Keep a triplex on hand to blow away any saliva bubbles on occlusal surfaces, and always start the scanner in the mouth so that the first thing that your scanner sees is teeth. I have always found finger retraction is best. The retraction finger becomes the support bridge between your hand and the scanner head support, and just rolls along, clearing a path for your capture, and can be used to leverage the scanner for stability. Here I am, starting on the molar occlusion and rocking the scanner side to side, retracting with my finger and clearing the view path to avoid capturing any lip. When I come around to the buccal anteriors, I switch positions, starting on the occlusion surface of the other quadrant, come around the buccal and meet back at the midline anteriors. The same technique is applied on the upper, and you can see that it can achieve a great overall scan of the arch. With your full arch aligner cases, remember to scan at least 5mm of gum. Always assess your scans to ensure full anatomy is properly scanned. If the distal of the last molar is hard to reach, you can ask your patient to half close so that there is more stretch in the cheek and placing your scanner more disto-buccal. Trim your scans and look for foreign detached and attached anomalies in the scan. Now onto the bite scan. In a live patient, the best way to obtain good access of your back molars is to ask the patient to open, Stretch the cheek out using the scanner tip, then asking the patient to bite down and making sure the patient stays firm on their bite and does not change their bite while scanning. Scanning the whole buccal anatomy of top and bottom teeth together, past the gum line, we can expect the software to recognise the bite and pull the two arches together, or in some cases you will go into manual alignment. Now that both arches are complete with the bite, you can QC the full mouth scan, process and send to race aligners for an aligner treatment plan.